Was given the chance to review three very important abstracts that were presented at ASCO this year. The three included Adriatic, which was a study for limited stage small cell lung cancer patients. Basically, patients who had concurrent chemoradiation treatment were then randomized, and the section where they compared durvalumab versus placebo were presented at ASCO this year, and that was what I presented. Clear benefit with consolidation durvalumab, so that's really exciting. This is something we hadn't seen in a while in small cell lung cancer. The second study that I presented was from LAURA. LAURA is actually very similar in design. So basically, these patients were post-concurrent chemoradiation, locally advanced non-small cell lung cancer patients with an EGFR sensitizing mutation, and they were randomized 2-to-1 to either osimertinib or placebo. Again, clear benefit in the osimertinib arm, and I think that would be practice-changing. The third study that I presented was a 5-year update from the CROWN data. The CROWN study was a study for advanced metastatic stage ALK-positive non-small cell lung cancer patients, and they were randomized 1-to-1 to either lorlatinib or crizotinib. Basically, at the 5-year mark, the progression-free survival, the median had not been reached as of yet, and that's incredible. This is something that we had not seen in lung cancer, but perhaps in any solid tumor, and we were very excited when we saw that data. In the Adriatic study, patients with limited stage small cell lung cancer were randomized post-concurrent chemoradiation treatment to 3 arms. The arms that were presented at ASCO were the ones of durvalumab versus placebo. So when we compared the 2 arms, there were clear benefit in regards to progression-free survival as well as survival in these 2 arms. The LAURA study was a study for EGFR mutated patients who were locally advanced and who had finished concurrent chemoradiation. The patients were randomized 2-to-1 to receive osimertinib or placebo. The OS data that was presented was not mature. The maturity rate was only 20%. However, there was clear benefit seen from the Kaplan-Meier curve showing the progression-free survival. And we were very excited to see this happen because historically, these were the patients that were kind of left behind. So as you know, with early stage lung cancer with EGFR mutation post-surgery, patients were offered osimertinib based on the ADAURA study, which was positive for DFS and OS. And in the metastatic setting, of course, the FLAURA study demonstrated OS and PFS with osimertinib up front. So these stage 3 patients who were eligible for concurrent chemoradiation were kind of left out from those 2 extreme categories of early stage and late stage. And now that we have positive data in this population too, we're excited that we'd be able to offer osimertinib in stage 3 patients as well. The CROWN update was the 5-year update that was presented at ASCO this year, and the study was a comparison between crizotinib, which is a first-generation ALK inhibitor, versus lorlatinib, which is a third-generation ALK inhibitor. The Kaplan-Meier curves for both PFS as well as intracranial progression-free survival was excellent. We could see clear separation of the curves. So if it were to be between lorlatinib versus crizotinib, clearly we have lorlatinib as the winner. I think the question is, many of us are using second-generation ALK inhibitors up front, and this study was not a comparison against second-generation ALK inhibitors versus lorlatinib. So if you look at the median progression-free survival, whether you look at the investigator-assessed or blinded independent central review assessed PFS, the second-generation ALK TKIs are able to produce a median progression-free survival of 25 to 35 months. However, with lorlatinib, that median progression-free survival has not been met. At the 5-year mark, the PFS rate was at 60%. that means that it's going to surpass, right, these median numbers for second-generation ALK TKIs, and I think it means a lot. So if patients are started on upfront strong treatment, then perhaps they have a longer chance of survival, and by that point in time, we might be able to see more newer generations of ALK inhibitors come out, and I'm really excited to be able to say that perhaps, at least in some subset of lung cancer patients, we're starting to treat this more like a chronic disease. This was a real world case of a patient that I am currently treating, and for this patient I sincerely suggested lorlatinib as upfront treatment for a number of reasons. First of all, he was early 50s and very fit, very supportive family, so that's a place where you can go aggressive. Also, there were reasons scientifically that I wanted to be more aggressive, like for example, the concurrent TP53 mutation is a poor prognostic factor, and we know that other generations of ALK inhibitors did not do that well. Also, the fact that he could have had a punctate lesion in the brain, that worried me a lot. So we do want to use a drug that crosses over to the blood-brain barrier. So those were the two main reasons I wanted him to have a strong upfront treatment. I think patient and family counseling is almost everything. So you don't want to scare the patients or family members, but you do want to give them a heads up that these are the things that could happen, and it's okay that it could happen. As a matter of fact, I also presented data today that patients who were dose reduced in the first 16 weeks versus those patients who were not dose reduced, there were really no differences in PFS or intracranial PFS. So that was really comforting to know. So if you run into problems, it is okay to dose reduce. So you don't want your patients to be hiding problems from us. We want them to let us know when things happen. Things that we need to counsel and take care of are edema, high cholesterol, high triglycerides, and also CNS, central nervous system adverse events, and things include mood changes, hallucinations, vivid dreams. So it's really important that your patients as well as their family members are aware of the possibilities that these could occur, and if it does, to notify us right away so that we can manage it up front.